privilege of introducing Dr. José Ortiz, physician, surgeon, renowned epidemiologist from Guatemala. He is a recipient of the World Health Organization Scholarship in Reproductive Health. In addition to providing evidence-based care, Dr. Ortiz is the director of SARS-CoV-2 COVID-19 Pandemic Observatory in Guatemala. He brings 28 years of epidemiology experience. This includes providing patient care, leadership for frontline medical workers in the 1990s during the cholera epidemic. He also created the emergency response plan for the nation during the Ebola outbreak in Africa, in the event care providers in Guatemala needed to respond. Today, Dr. Ortiz will share his perspective and experience with frontline healthcare provider during COVID-19. He'll be joined by Dr. Brad Dibble, cardiologist at Royal Victoria Hospital and Pace Cardiology in Barrie, Ontario, for this honest and open discussion. And Jennifer Klusenak sends her regards. She was also a representative from the Royal Victoria Regional Health Centre. Unfortunately, she got called into the ICU due to the current state of emergency in Ontario. From behalf of Georgian and the RISE event, we wish all of our frontline workers to be safe and healthy during this time, and we really appreciate all your efforts. Moderating this discussion today is Sarah Bentham, Director of Henry Bernick's Entrepreneurship. And we also have Celia Doucette here to help with any translation. Welcome all.
Thank you so much. Firstly, I'm honored to meet you, Dr. Ortiz, and I wanted to thank you for your time today to share space to have this conversation about your role in the COVID-19 pandemic in Guatemala from that perspective. And this keynote session has been highly anticipated by our audience, and I'm thrilled to be here with you today. I'm also so grateful to have you, Dr. Dibble, here, and to have these two busy doctors share their experiences in this. It will allow us the opportunity for diverse experiences from a global perspective. Cecilia is joining me today to translate. It's so helpful to have a brilliant colleague who speaks 2 languages. And I also wanted to acknowledge that I'm not a healthcare professional, and I call out to my colleagues and the experts in the field who are joining us as part of the audience, and I know that they'll have questions that we can save for the end. Dr. Ortiz, I've read with great interest your work on the observatory based on the mathematical model on the coefficients used by the Imperial College of British Sciences. And so I wanted to share with the audience, what is the main role of the observatory and why was it created? Cecilia will take time to translate as well.
Thank you very much. El observatorio fue creado como una respuesta de la sociedad civil organizada a la pandemia de COVID-19 en Guatemala, que existía o existe una ausencia de política pública en materia de salud y el ministerio no asumía su rol rector. Eventualmente, el observatorio se lanza con un modelo matemático que estima el impacto de la pandemia para planificar los servicios y poder atender la pandemia en toda su dimensión.
The observatory was created in response to civil unrest due to the clear absence of public policy to address the SARS-CoV-2 COVID-19 pandemic in Guatemala. I've attached a presentation to the platform to provide more context for you related to the mathematical model for the response of COVID-19. Then you can go and download it and check.
Thank you so much. If you can share those 3 key findings from the observatory, I think that will help our audience understand it.
Los 3 puntos claves que abordó el observatorio fue la estimación de la magnitud tanto de la mortalidad como la morbilidad atribuida a la enfermedad de COVID-19 y el proponer ese modelo matemático para poder monitorizar si se podía interrumpir la transmisión de la enfermedad basado en la evidencia. Utilizamos metodologías como la eHealth y el mHealth para poder abordar este tema y que el ministerio pudiera adoptar esa metodología para monitorizar a los enfermos. Y también se proveyó información muy importante de medidas preventivas para poder evitar la propagación de la enfermedad e interrumpir la transmisión de la enfermedad. Esos fueron los 3 principales logros que tuvo el observatorio y que tuvieron impacto en la pandemia en búsqueda de aplanar la curva epidémica del COVID-19.
Sure, the 3 key main findings were 1 is estimating the magnitude of the SARS-CoV-2 COVID-19 pandemic based on the rates of the incidence of new cases and mortality attributed to the disease in each of the 3 waves based on coefficients of the Imperial College of London. which helped to address the estimate by each province in the country of Guatemala. The second one is proposing a model of disruption of COVID-19 transmission based on e-health and m-health base levels, care of technology, where municipalities play an important role with infrastructure that they can provide to the Ministry of Public Health, as well as to the social assistance, to expand coverage and reference based on mild, moderated, and severe patients require intensive care. And the third one was providing important and relevant and trustful information to the population to take protective measures, encouraging the government to create public policies based on the analysis and data provided for the measures needed, as they are simple to implement and monitored by the Ministry of Public Health and Social Assistance, as the main objective is to flatten the curve in each of its waves.
Es importante indicar que el modelo estimó el registro de los pacientes infectados, llegándose a determinar que por cada paciente infectado habían 19 pacientes sin diagnóstico.
The model accomplished that for 19 patients diagnosed, there was 19 that were not diagnosed.
No, that's interesting. Resiliency is a topic that we explore often and one that's close to my heart. Dr. Ortiz, if you can describe the COVID-19 resiliency in your country.
Comparados con este comentario, valdría la pena hacerlo, está fuera de la respuesta, pero comparados con Canadá, que tiene una estructura de un programa de resiliencia, Guatemala no lo tiene. Pero eventualmente la población buscó su propia resiliencia a través del teletrabajo, la suspensión temporal del trabajo con subsidio temporal del gobierno en sus salarios y reinventar la economía a través de otros medios de producción que podía ofrecer el país y fuentes de trabajo y para poder afrontar la pandemia.
The important thing about resiliency in Guatemala is that economically active population adapted, keep production and maintain jobs in the country. And a few ways they did this is with telework or work from home, temporary suspension of work with government aid, and temporary subsidy, reinvent the ways that businesses done and services to the customer to avoid going out of the shops, preventing people to spreading the COVID-19, and the creation of new ways to work in order to respond to the pandemic. But it's good to mention that even if Guatemala didn't have a structure and a plan for this, they could accomplish this. Like Canada had one really solid, Guatemala didn't. They lack of it. And even with that, they were able to accomplish this resiliency in the country.
Like the response was very similar. I think we can all agree around the work from home and creating new ways to get our groceries and the goods that we need. And we're back in that. So I hear that. Thank you. Thank you for your perspective on that. And so that we have sort of this baseline of understanding of what it's like right now in your country. Also, I wanted to bring Dr. Dibble into this conversation. He's been patiently waiting on the sides, and so that we can hear from you both and really see and draw the similarities and understand what the differences in the perspectives of the two countries. Maybe I can turn it over to Dr. Dibble and talk to you about your first experience with a patient who contracted COVID-19 or how that existed within your practice.
The first patients I had with concerns about COVID were actually new referrals where they were concerned about effects they had on their cardiovascular system. So they weren't prior cardiovascular patients, and they were concerned because we hear about these long haulers, these patients who continue to have problems of shortness of breath and fatigue, weakness in general, sometimes palpitations. And those are all symptoms that can sometimes just be because somebody's been hit by an illness, but sometimes they reflect cardiovascular disease. So most of the first COVID issues I saw were patients who were just worried about their heart and needed to kind of have it checked out. Fortunately, I don't think I've had any patients that I have been following actively who have succumbed to COVID. But part of that issue is that a lot of patients have been afraid of going to the hospital, getting tested. So for example, somebody might have a problem with chest pain, and normally they would go to the emergency department, but they're afraid of COVID, so they stay at home and they sustain their heart attack there. So it's almost an indirect effect of the pandemic that they're struggling with some health issues. Or patients who have serious heart conditions we need to follow regularly, perhaps every 3 or 6 months, we need to check on what their heart status is with testing, and they don't want to come in for the testing, so that their health is being ignored. That's actually what I would say has been the biggest impact. And then of course the psychological stress of dealing with a pandemic, which affects everyone, not uniquely cardiovascular patients.
We've had conversations about how innovation can play a role in that. And I know we were talking about wearable devices and how you've been able to track patients' health using those.
One of the very first things we did in reaction to the pandemic was we wanted to make sure that not all testing was lost. And a lot of it is for Holter monitoring, to monitor heart rhythms, which can be done anywhere from 1 day to 14 days. So we changed it so that they didn't have to come in to get hooked up, that we could mail it out to them. And it's a very easy device to apply. It's very easy to hook up, then they mail it back at our expense, postage paid. That was one of the first steps. But other things now we're starting to emphasize even more, like the latest Apple Watch can actually do an ECG. And then there's one you hear about on TV, Cardia Mobile, that you can buy from Amazon. We actually sell a pen at the PACE office that can record an ECG. So people can have devices. We've had those for a long time that were always helpful if people had symptoms that were really infrequent, like every 3 months. Well, you can't Holter somebody constantly for every 3 months. So that technology's always been there. But now a lot of patients have really grabbed onto it because now they can do these things that they're comfortable, they're at home, they download it into their computer and email it to us. And I've actually made the diagnosis in probably a dozen patients because of that technology where they didn't even have to come in for our testing. So it's been great.
I love hearing about these ways that we're solving challenges as we go through this. It's very much on the fly. Dr. Ortiz, if you can describe your first experience with a patient who contracted COVID-19.
Yes, ok. Pues mi primera experiencia fue atendiendo a una persona con trabajo de parto y que llegó a la sala de emergencias con una dilatación completa. Se atendió el parto y eventualmente se le hizo la prueba de COVID-19 y salió positiva. Ninguno de los que estábamos atendiendo a la paciente sabíamos que tenía la enfermedad. Subsecuentemente se le confirmó con una PCR de tiempo real y el resultado salió positivo. Afortunadamente ninguno de los que atendimos el parto y el personal de enfermería salió infectado con COVID-19.
My first experience caring for a person with COVID-19 was a woman who was in active labor. She was full term and was not diagnosed with COVID-19 until after she delivered, so we didn't know she had it. Fortunately, she was wearing personal protective equipment and she was asymptomatic, and so was the newborn, with no complications. Subsequently, PCR-TR was performed for SARS-CoV-2 COVID-19. As her test result was positive, the hospital's biosecurity protocols were activated, and we proceeded to clean all delivery areas and operating room and newborn assessment areas.
Maternal health and postpartum care is just top of mind as we go through this as well, and that reluctance to re-enter the hospital. That's an interesting story. Thank you for sharing that. What keeps you going and helps you to cope throughout this situation? Dr. Ortiz, if you'd like to start.
Okay, bueno, lo que nos motiva para salir adelante en la pandemia es, ya que tenemos recursos limitados, depende de la dedicación del personal de salud para administrar bien los proveedores de salud como somos nosotros. Tenemos que ingeniárnoslas para poder atender a las personas. Recursos limitados ya de por sí en un país en donde hay demasiada pobreza. Esto trae confort a las personas ya que se sienten atendidas y no se sienten solas durante su proceso de enfermedad.
I had to mention that with very limited resources, the response to the pandemic depends on the dedication, the discipline, and the proper use of those limited resources. Healthcare workers are the key to providing and managing proper care to patients, always having the spirit of service and the non-social stigmatization of cases that are positive to the disease, sharing and providing hope and comfort to every patient who suffers from it. For them to fight and survive the disease, it is vital that the patient feels cared for and understood.
This is an excellent perspective, especially in regard to hope, and I know we'll talk about that closer to the end with our line of questioning. What keeps you going, helps you to cope during this situation?
Professionally, we've certainly made lots of adaptations at the office to allow us to continue to provide the healthcare in a safe manner. Everybody's properly arranged in PPE and everybody gets screened, and cleaning protocols for all the equipment. Patient-wise, although they come in for their test, still the vast majority of my assessments are remote, but they don't have to feel uncomfortable coming in, usually either by phone or sometimes with a video conference kind of format. The nice thing about my specialty is, although there are some patients I really need to examine, much of the time it's just from the history. So we've been able to kind of do okay. And then as we talked about, we have some technologies we can provide them without even having to come in. Personally, I've done what many people seem to have had to do. We try and support our community. So twice a week we order in for food, like we go and pick ups for the restaurants that have been struggling. If it wasn't for Netflix and Zoom, the things to try and stay sane with the family and the household, I have lots of different Zoom groups I meet with on different occasions to try to keep connected with people outside the household. And that's important too. And so far, we seem to be coping okay, I think, but just like everyone, very interested in having this pandemic be over with.
I couldn't agree more. Dr. Ortiz, what has been your biggest challenge so far in this pandemic?
Hacer que el gobierno de Guatemala utilizara la información que se generó en el observatorio que fuera útil, centrada en las medidas del paciente en función de la medicina basada en la evidencia y para que se tuviera una mejor abordaje en la epidemia del COVID-19 en esta pandemia.
Getting the government of Guatemala to take useful technical patient-centered measures based on evidence-based medicine provided by the observatory for the best approach and fight against the pandemic. It's been one of the biggest challenges.
Yeah, having read through that, I can see how that would be a challenge for sure. Dr. Dibble, what's been your biggest challenge?
I'm going to bring this one up because I've found this frustrating throughout this past year, and it's similar to what I've had to deal with in climate change, where there's a lot of people who don't believe the facts that are there before them. I'd say one of the biggest challenges is dealing with people who first didn't believe there was really a pandemic, that we needed to do any kind of lockdown, that the health mattered, and even anti-maskers. That is so frustrating when people will find some source of information that supports their perspective without listening to the best experts on the world. And I've even had some people say, I'm not going to get a vaccine. I've done my research. And I'm thinking, well, you've never done as much research as the virologists on the planet have done. They still have all the access to the same information on the internet you do. Plus, they have more information access that you don't have. These are their recommendations. These are the best experts in the world about it. Why would you say my little internet surfing has given me enough information to go against them? So that's been frustrating. Fortunately, the people in my main circles, both professionally and personally, have not been in that category, but you cross their paths enough and you hear about rallies in downtown Barrie that seem to try and rile people up about those. And that's unfortunately going to work against the solutions we need to get this pandemic under control.
Ortiz, this question is related to the health resources, and it's not possible for governments and medical systems to ensure there's adequate health care for all. Has this been your experience, and can you describe it? And then Cecilia, just sort of a follow-up, is there's a question that came in from the audience around PPE in high demand in Guatemala.
Sí, bueno, cuando los recursos son limitados, ocurre lo que ocurrió en Guatemala, que los servicios de salud colapsaron. Y colapsaron de tal manera de que no se daban abasto para atender a toda la población enferma. Sobre todo Guatemala, recordemos que es un país o un estado con ingresos medios y que no destina mucho de su Producto Interno Bruto para atender al sector salud.
My experience is the same as all countries. The exhaustion and the burden of healthcare workers and oversaturation of cases caused the healthcare system to collapse. Showing and providing the infrastructure in Guatemala is poor and insufficient, as well as the limited resources to be able to deal with each case. Guatemala is a developing country with a middle income, and the pandemic has shown that how little the government has invested in healthcare.
And just related to the question about PPE, was that an issue for your country? I know at Georgian College, as Dr. Jamie Doran mentioned, we were able to provide solutions there, and just curious as how Guatemala dealt with that.
Está limitada y tenemos existencias algunos días solo para un día y otros solo para una semana.
It is really limited to the point that we have enough for one day or a week.
That is a huge challenge. I have a question here. Thank you to our president and CEO, Dr. Marilyn Westmoynes. Data is emerging that there's a correlation between higher socioeconomic status and higher uptake on the vaccine. And so steps are necessary to build the confidence with the less fortunate in our societies. And Dr. Dibble, I'll start with you.
Wow, that's an excellent question. And I think a tough one because that extends beyond things like just acceptance of vaccines when the socioeconomic scale has a big impact on the way a lot of people take things on. From my perspective, the way Canada has taken this on, and when I listen to experts in Ontario, I think we're doing the right thing. We're trying to be very factual and try and explain everything. My experience is some people are going to remain skeptical no matter what they hear because they'll find reasons to just disregard it. They'll find an explanation like, well, that's big business, that's big pharma trying to make money, and that's the only reason for the vaccines. But I think for those who are open-minded, if we can at least provide them that simple, straight, factual information without judgment about it and make sure it's available and accessible. And if we can ever tack onto that people who are part of that same group, who they would maybe be more likely to listen to rather than the white-haired specialists who they have no clue about. But if they have somebody from their similar demographic who can be a proponent for that, I think that goes a long way.
I agree. Representation and advocacy is key. Dr. Ortiz, I wanted to reference your recently published article article forecast for a second wave and announced disaster. Has that article made any impact on the response to the pandemic in Guatemala?
Esa fue una publicación muy importante, ya que el observatorio hizo una presión muy importante sobre el gobierno para tomar decisiones políticas oportunas a través del modelo matemático, y esto generó una presión en el Congreso y en los medios de comunicación para que el gobierno tomara acciones para evitar que la pandemia avanzara con la magnitud que estaba avanzando. Tanto el Congreso de Guatemala como los medios de comunicación como Guatevisión nos dieron un reconocimiento por la presión pública que ejerció el observatorio para poder afrontar la pandemia y poder orientar a la población también con la información que se brindó.
Indeed, the population became more aware, and the central government was forced to take action in the face of the imminent disaster that was predicted with the mathematical model provided by the observatory. The article generated political pressure in Congress and received support and attention from televised and written press in Guatemala to help share the observatory's work and objective. We also received a public recognition from the Commission on Human Rights from Guatemala with this article, and televised press, TV News Guatevisión, which is the highest television ranking in our country. TV News also recognized the work the observatory did to push and cause change-making action to push the government to act fast.
This is a good outcome. That's a good strategy. Throughout your career, have you ever experienced a situation comparable to COVID-19?
Nothing like this. First of all, this is the first pandemic that anybody alive has had to deal with. I did have to go through SARS when we dealt with that about 18 years ago. And so we took a lot of the similar sorts of measures at that time at RVH, where you had to enter through a certain spot and you had to go through all sorts of careful cleaning protocols, and things got canceled. Fortunately, we never actually did get cases in Barrie, and it wasn't the same kind of contagiousness that led to it being a pandemic. It was serious when it happened to the pockets that got it, like Toronto. That's the closest I've had. To have had to totally change the way you do business in healthcare is unheard of. I've never seen anything like this. And we were talking about resources a moment ago, and things like people think about PPE or think about vaccines or think about OR time. But a really valuable resource that I have to remember is our frontline workers, because the burnout from this has been huge. And I know colleagues who have told me that they're moving up their timeline from when they're going to come off call, or they're moving up their timeline from when they're going to retire. And I think for some people, we're hearing in our nursing colleagues that a lot of them are going to leave the profession because it was just too hard. So that's a hugely precious resource that has really had to struggle through this and has never had to go through anything like that in their careers either.
I agree. And on that SARS experience that we had, I worked in tourism in Toronto, and so much different than what it was up in the north. Dr. Ortiz, if you want to answer this question next.
Okay, bueno, la experiencia que tuve fue con la epidemia del cólera morbus en la década de los 80s en nuestro país, donde mucha gente murió y el sistema de salud se vio demandado para la atención de los pacientes. En esa ocasión fui víctima también del mismo cólera, ya que la epidemia se había generalizado y los trabajadores de salud también se habían infectado durante el proceso de atención.
Indeed, the cholera morbus epidemic in Guatemala in the 1980s led to thousands of cases of deaths, demanding from the health system a rapid response to the epidemic. And on that occasion, I was in front line for that epidemic, and in the process of providing healthcare to patients, I contracted cholera. I was victim of the disease, but I survived it.
Survived it.
You're very fortunate. Yeah, we're fortunate that you're here. Dr. Ortiz, I'll stick with you on this question. What do you think can be done across borders to better support one another during the pandemic?
Sí, yo creo que la importancia es el apoyo que se haga a través del comercio, en una economía globalizada en donde todos los países se puedan apoyar y poder tener una resiliencia económica y un respiro para poder responder de manera global ante la pandemia y ante los problemas económicos que generó la misma.
The important thing at the moment is commercial trade and the survival of the global economy. The global support, it's important, and this depends on public policies, new forms of trade being established, and the creation of new companies to lend support to stop the spread of COVID-19. We know more about the disease and how to prevent the transmission of it, and we need to use that knowledge and apply it. But creating those relationships and connections globally and that support is what is going to help us fight this.
We see that as well, especially with some of our community partners in MPC and Innovative Automation, who have done amazing work in helping us to stop the spread. And I just wanted to shout them out as well. Dr. Dibble, what do you think can be done across borders to better support one another during this pandemic?
Some countries and some regions are doing better than others, and I would like to see more adaptation towards the more successful models that have worked. Since it's a global issue, it's going to require global efforts to really make a difference. And if we have a few groups that are not doing well, or a few regions, it'd be good if they could kind of acknowledge and recognize that and start to adapt to the models that have worked. I have friends who live in the UK, and they've been pretty much on a complete lockdown, stay at home since the end of December, to the point where in London recently, the case count has been almost zero. Finally started to open up to being allowed to be out of the house. Here in Ontario, we've kind of had this more roller coaster approach where we open and then we close, and we open and we close. And I think my friends in the UK report that they've clearly been doing a better job at it. And that's where I almost think we need to start looking at which models have worked and cooperate that way. But economically, I wouldn't suggest anything more than what was already said.
Okay, thank you for that. We have a lot of questions in the chat around the vaccine situation. We're looking to hear more, Dr. Ortiz, about the vaccine situation in Guatemala, and also some interest in understanding which vaccines are being delivered there.
Crítica. La situación desde que el gobierno no ha podido adquirirles vacunas y solo hemos vivido de donaciones de Israel y de la India. Las únicas vacunas disponibles fueron muy pocas de Moderna y 200,000 dosis de AstraZeneca. Pero el gobierno de Guatemala no ha podido adquirirlas, ya que está en una lista de espera muy grande y el proceso administrativo no ha sido del todo transparente.
The process to getting the vaccines to Guatemala, it's been really rocky, not transparent, difficult. There's just 200,000 AstraZeneca doses available, and we are on a wait list for our country to get access to these vaccines, but we are relying on donations to help the population. And the ones that are available is AstraZeneca and Moderna, and the donations are coming from India and Israel.
And I know there was a question regarding if Guatemala is part of the UN COVAX program.
Sí, sí. Guatemala es parte del sistema COVAX. El problema con Guatemala es que nunca dio financiamiento para investigar el desarrollo de vacunas.
Yes, we are part of that program, but the problem is that there is no transparency to investigate the process and delivery of those vaccines.
Thank you for that. And thank you, David Bell. We have a question coming in. And Dr. Dibble, I'll start with you. So how do you feel that COVID-19 has turned the spotlight on the climate crisis, both in Canada, and then we'll talk about Guatemala, and has it changed the dialogue or raised the alarm more? And I know we touched a little bit on this in your past presentation, and it's great to tie it all together here.
That's a good question. My involvement with climate change with respect to the pandemic has increased in one way and decreased in another. I referred to how I was part of a group of very physicians. And once the pandemic started and all of our healthcare needs changed, we kind of put that on a back burner, and it's still on a back burner. So we have not been doing our local efforts, but the climate reality group that I'm part of has started to modify its approach. They always did their training in person on various places all around the world. Now they're doing it virtually. They did 2 last summer, and they're doing 1 later this month. And I've been a mentor in every one of those. So there's a lot of Zoom interaction. I still have virtual tables similar to the kinds of events that Georgian colleges put on, and we have large plenary sessions and then small workout groups, and so that's a big part of how it's adapted. We keep trying to get the message out, and hopefully some of the lessons we learned from the pandemic can be applied to how we deal with climate crisis, because in some ways there are those similarities. Time will tell.
Dr. Ortiz?
Por el COVID, bueno, la respuesta es muy débil en relación al medio ambiente y el COVID-19. La situación de Guatemala es que estamos en la tercera oleada y tenemos un índice ocupacional más del 100% de todos los camas de intensivo. Llegamos a 120, 130% de ocupación.
The response from the Guatemalan government about the environment is really weak and late and behind. The problem is as well that the healthcare system is saturated and the beds are at capacity of 100, 120%. There's a delay in response from the government and the situation in Guatemala for climate change, unfortunately.
I do have a last question, and you're both change makers and thought leaders, especially with respect to the transparency and decision making. So I go back to, how do you find resiliency and strength to pursue that change and then also stay motivated? So we talked about how you're coping, but just to be motivated.
Sí, pues como mencionamos anteriormente, el observatorio ha sido un agente de cambio y de presión para el gobierno para mejorar la transparencia de la gestión pública. Tenemos aspectos negativos como positivos. Los negativos como la falta que se han evidenciado la falta de transparencia, la recolección de los impuestos que no ha sido adecuada, los préstamos indebidos y endeudamiento del país, y medidas que no tenían ningún efecto inmediato en el aplanamiento de la curva, y los efectos positivos que se generaron cambios en el sistema de salud derivado de la presión y este proceso. Promover la revisión de política pública en materia de legislación a nivel del Congreso y proponer intervenciones claras para poder abatir la epidemia.
SARS-CoV-2 COVID-19 observatory was created based on the absence of policy and technical capacity from the Ministry of Public Health and Social Assistance in Guatemala to address the pandemic. With positive and negative forces in this regard, the negative outcomes seen by the observatory are lack of transparency by the government in the management of economic and resources like tax collection, loans that indebted the country and were justified by the fight against COVID-19, measures that are not and were not useful to flattening the curves, and mistakes in handling cases early on due to the lack of understanding about how the spread of COVID-19 worked. And the positive outcomes made by the observatory, which caused changes, was mainly the pressure that generated on the government to act fast and act properly and transparently, generating changes in the healthcare system and its processes, promoting reviews and policies of encouraging proper management of economic resources by the Guatemalan Congress, and clear intervention measures for stopping the spread of the disease includes one based on at-risk population, healthcare practices, and labor rights to stop the disease and flatten the curves.
And Dr. Dibble, from your perspective, how do you find resiliency and to pursue that change and stay motivated during this pandemic?
I'll refer to two quick things. One is I've had a rule for a long time that no matter how little hope there seems to be, whether it's the climate crisis, whether it's healthcare, I want to continue to fight the fight because I want to look back later on in life, or maybe my children, my grandchildren look and say, well, at least he was never part of the problem. He was always trying to be part of the solution. And that has worked as a little mantra for me. But at times when you do really feel down about things like this, there are always other leaders who can continue to inspire you and bolster yourself back up. So I seek those people out and make sure some of their resiliency that maybe I've lost for a little bit, I can absorb from them. And so, for example, the climate change, I'm going to have a training session with Al Gore later this month, and he always helps inspire me in that regard. And there are always lots of healthcare leaders too who help keep going. So those are the two little tricks I tend to use.
I appreciate that. And that's a perfect note to sort of close this discussion out. I looked at mantras as well. And so one of my favorites is from Dr. Robin Hanley Defoe. We'll never know the full impact of what being filled with hope can do for ourselves and others. And so I heard through this conversation that you both are hope-filled, even despite the huge challenges that we face both in Guatemala and in Canada. And you've given me a little bit more hope today. It's been starting to elude us a little bit during this third wave in our recent stay-at-home order. Dr. Ortiz, when this is all behind us, I hope you come to Canada where we can show you all around Georgian College and we can continue this conversation over coffee. I'm sure many of my colleagues that took part in this today would love to join us. And Dr. Dibble, thank you so much for your time today and for your previous session. It's been an honor to hear from both of you. And Cecilia, thank you for your help in translation.
Thank you, Sarah. And thank you again, Dr. Ortiz, for sharing your global perspective and experiences of frontline healthcare provider in Guatemala. RISE 2021 was designed to provide all of the attendees with a virtual opportunity to learn something new, to try something they haven't done before, and to celebrate innovation in inspiring individuals like Dr. Ortiz. Thank you for being a change maker and providing care during COVID-19. Please stay safe. Thank you as well to Sarah Bentham, as well as Dr. Dibble for joining in the conversation too. On behalf of RISE, I thank you very much for attending today, and thank you to all of our speakers, as well as those who are helping behind the scenes. So shout out to Kat and Celia for all their hard work as well. Thank you for organizing this. Have a great day.